Welcome back to the Movement Professional Podcast. Today I'm thrilled to welcome back a returning guest, Meghan Morley, founder of Cognitive Pursuits. Meghan has been on the podcast before, sharing her expertise at the intersection of neuroscience, psychology, and cognitive optimization. But this time she's joining us not only as a leader in the world of cognitive health, but also in a new role, as a new mother. In this episode, we have an honest and insightful conversation about the challenges of postpartum life, from the mental and emotional shifts to the physical demands, and how they intersect with cognitive function and resilience. Meghan also shares powerful strategies for behavioral change, both for new mothers and for anyone looking to improve focus, manage stress, and sustain healthy habits. If you're interested in real, applicable strategies for navigating life's transitions while optimizing your mental game, you're going to love this one. Welcome back to the Movement Professional Podcast. It's been a while. I'm back here with Meghan Morley, and Meghan and I we've done several conversations now. We haven't spoken in a little while. I haven't done much podcasting in a little while, but it's good to be back. And last time Meghan and I spoke, you were about to be a mother. Now you are a mother, so congratulations on that. And
Thank
so
you.
your daughter is now 15 months, so you've got some experience under your belt now. Want to tell us how that's going and any unique challenges you've experienced so far?
Sure. Thank you for having me back. It's great to see you again.
Likewise.
So I had my daughter, and yep, she's 15 months. It's been a wild ride. And I am pregnant again, due in
All right.
May. So I'm about to be a mother
Congratulations.
twice. Thank you. So it's been a big change and a big journey. And being in the mental health space and in the fitness space for as long as I have, it's been very rewarding to get to be in the lived experience. Now I've worked so many women who have gone through it and gotten to be, on the sidelines with them, but now actually having gone through it and being able to really relate on a whole other level to just the challenges around scheduling, taking care of yourself, finding balance, communicating with your partner and with your family and the people around you that are there to support you. There's so many different struggles and different challenges. And I think not having the experience of a parent, not just a mother or a birthing person, but as a parent in general, and now being on the other side of that, those struggles, which may seem small to some
Mhm.
people, are actually really impactful in daily life, and just taking care of yourself as a human being outside of your role as a parent can become very, very stressful and challenging. And I'm just happy now as a provider to be able to relate to that experience on
Right.
a deeper level.
100%. Anything that's surprised you, like going in, you thought like this wouldn't be a problem, and something that's really just been a struggle that's kind of, or just a challenge that surprised you?
Yeah, I think speaking about movement for a second, I've been a not to toot my own horn, but like
Mhm.
a pretty strong person for a really long time. I've been training in the strength world, and before that, I was, doing indoor cycling and other things. So I've been a pretty active and strong person, and I ended up after quite a long labor having a C-section with my daughter, and the road back to strength has been extremely challenging on a level that I just didn't realize would be, both from the perspective of my body taking time to heal and finding this balance between healing and growing or gaining
Right.
strength, and trying to find that middle point, because the growth excuse me, the healing process is extremely long, but you
Right.
are ready to start that strength growth process during the healing process, and finding that sweet spot has been really challenging. But also from a time perspective, because now I have this human that is relying on me. So where I used to be able to walk into a gym and take an hour, maybe an hour and a half to do my mobility and my strength work and get some conditioning. And I've got to fit that into a much tighter schedule. So I think that has been the biggest surprise to me. Not that I didn't expect it to be a challenge, but I didn't expect it to be a challenge on the level that it has been, just based on the knowledge that I thought that I was walking, into this journey with.
Right. Right. And I think sometimes when we're in the fitness space, with like
we feel like a little bit invincible to change. Like, well, yeah, if we change, like we'll be able to bounce back because we have all this knowledge, and and we're teaching others. And I know, like, observing my wife being pregnant, it's just like there's no the drasticness of the change of your body. There's nothing else like it that you could experience in your life, and it's amazing that you bounce back at all. But
Mhm.
yes, it's like
Yeah,
it's pretty awesome, like the change that does happen in your body. And I think it's got to be something that is to be, is a different experience for you.
definitely. And I think also just from a mindset perspective for other women who are, getting back to their strength work or whatever your goals are, is that not all parts of my body have progressed at the same
Right, right.
rate. So, my upper body strength, for instance, came back pretty quickly and
Mhm.
was pretty strong because one, I'm carrying this child around with me a lot.
Right,
So there's a
right.
lot of functional strength involved in that. But also, um, while the core is obviously super involved with it, there were ways for me to train that without putting so much pressure on my core, where my legs, especially my glutes and hamstrings, which historically have been weak for me and I've had
Hmm.
to spend extra time on, really have lagged behind, partially because my core took so long to recover. So working those areas became challenging at some point in progressing them. But also just I didn't have the energy to uh, pull out the barbell and start
Right, right,
deadlifting, in the way that I was happy to pick up a kettlebell and start pressing. So
right. Mm.
um, I think that's something that I was surprised about, and I kind of found moments where I was beating myself up a little bit about it. That those the rates were different. But if that helps any of the other women out there that are
Yeah,
getting back to training, it's like it takes time. It will all come, and you just have to let each kind of function or movement pattern or whatever stand on its own and work on them.
right.
Obviously as a program, but allow space for them to progress differently.
I know we had spoke before about like you being in a community of other strong women, and
Mhm.
just like everybody going through their own personal experience with pregnancy, and just you sort of get like an expectation because you see, some people like doing what would be considered like really well, like later
Mhm.
on in pregnancy, and just like even recovering quicker. And then that could put like unnecessary pressure on you that you're supposed to do the same thing. But it's just like there, like you mentioned, there's like so many variables to every individual's experience.
Yeah. And even I will just to anecdote that, like,
Hmm.
in my second pregnancy, and
Right.
of course I recognize that they're close together.
Hmm.
And I wasn't like I was back at my same strength that I was, before I got pregnant the first time. When I got pregnant the second time, however, it's interesting, even though I didn't start at as strong of a place, there are certain things that I am actually much more easily accomplishing in my second pregnancy that I just couldn't in my first. So even from
Interesting.
pregnancy to pregnancy, really seeing some differences, even though I'm not as strong, like towards the end of my first pregnancy, like the idea of doing any sort of like hip hinge snap movement, like any sort of ballistic movement was like it was not happening. Where
Yeah.
this at this point, I actually am doing ballistics pretty well, and been kind of rocking through that in a way that, even though I'm maybe not as strong, the bell isn't as big, I'm still able to, tap into that movement pattern and feel good about it. Where in my first pregnancy, even though I started off at a way stronger spot, I had just gotten my like biggest deadlift ever, and I was doing pull-ups with, kettlebells strapped to my waist, and all this stuff. Certain things really fell off, and
Right.
so treating also each pregnancy differently, I think, is really important too, and just listening to your body as much as
Yeah.
possible.
So it's interesting. How about like the time to train? Like, have you? I'm sure that's changed. Like figuring out like where to get little pockets of training in. How have you managed that now having a little one?
Yeah, I think a couple of things. One is having really targeted goals has been
Hmm.
really important, and I'm sure we'll talk more about that
Hmm.
later in
Yeah.
our conversation. But having really specific goals and uh, setting up programs for myself that are achievable in kind of bite size. So whatever pressing program I'm working on, that press program might stand alone as my workout that day, or it might get stacked with something else that I'm working on. And I think having these specific goals and programs that I can kind of mix and match, depending on how much time I have that day,
Mm.
has been really helpful. I think the other component that I've been really using a lot and used a lot, especially early when I was just coming back to kettlebell work after my first child was born, is iron cardio, which is a Brett Jones Strong First protocol. What a great program for new moms. You can set the timer, do the work within that set timer, get the movement patterns in. I've really found that to be extremely helpful and just really time efficient. So I think finding those programs and that can be has been really helpful, because some days I have 20 minutes and some days I have an hour, and I have to figure out how to make that feel okay for me as somebody who is used to training 4 or 5 days a week for an hour at a time. So I think that's been really helpful. And if you don't know what I'm talking about, find somebody in your area. There are plenty of amazing trainers that are pre and postnatal certified and also Strong First certified. There's a lot of women that have both these days, or RKC, and these types of things. And I think finding somebody in your area that can help you program can be really helpful, if what I'm saying sounds like gibberish.
Well, and that's where we met, like in the Strong First community. Yeah. And I mean, I know as a dad, and just like wanting to be around my kids more often and still being able to train. Like something very similar to the iron cardio is the strong endurance practice. So I took that coursework like back in like 2017, and it was stuff like you and I are like already doing, but it just sort of like, I think, gave validation to this idea that you don't need to make it too complex. And it also doesn't need to be like too hard on your body and for it to be effective. But we also don't need to just be going to the gym either. And I think that's what's like, you're really going to have to find a way to adapt to be able to do things at home. I think as you get busier as a parent, or just if you have other responsibilities in life, especially if you want to continue to get enough volume in to make some of the changes that you want to make. And I think like that strong endurance piece, where a lot of it is just you're doing like 1 or 2 movements, you're on the minute timer, or you're just sort of like using your own body signals to say, I've had enough recovery, I'm going to go again. Yeah. And you could be watching TV, you could have your, I like, if I know I have a workout in, and I could go in my own gym, but I could also come home and be around my kids, and I could do that same workout. I'm going to go home and do it in front of the TV with my kids around, just because psychologically, it makes me feel better. It makes me feel like more of a present father. Yeah. And I think those type of workouts are beautiful. So like Strong First, like for me, like it really builds in on that simplicity. It's like all you need is a kettlebell. Yeah. And it's certainly they have programming for other things, but when time is strapped, when space is strapped, and you just need like one kettlebell, you can do a lot. And there's like that validation, because they give you the science behind it, that you're not like cheating yourself. You're actually getting maybe more benefit than you would if you're like mixing it up too much.
Absolutely. And especially in those pockets where I was talking about at the beginning about finding that balance between healing and growth. It's like I didn't need to be cooked at the end of a workout to be moving in the direction that I wanted to. I just needed to do the work. Right. And before I knew it, when I first came back, I was working with a 10 kg. Before I knew it, I was back with my 12. Before I knew it, I was able to go back to my 16, which is the bell that I like to work with the most, kilograms for those of you. So
we get in this language of Strong First, really.
Kilograms. And so
it's second nature too.
Exactly. And so you don't even notice the progress. And then all of a sudden you're standing there with a bigger bell in front of you. And that feels so good. Because you didn't fry yourself. So now I can't work out for 3 days.
Yeah. And I think there's some parallels, like with any recovery, like you're recovering from a surgery, or you're just kind of getting older, and your body has to recover more frequently from things that you didn't feel it needed to recover from before. And just that idea of you build recovery actually by building that aerobic engine. And some of the things that I think you get from those type of like strong endurance type of workouts is you're still able to keep like the load and the power element to it, but you need to, in order to build an aerobic capacity, you need time. Like it doesn't actually have to be that hard, and it's not really supposed to be that hard, or you're doing something else. But if you really were to just look at your weekly time allotment for fitness, a lot of the stuff that will take up the most time is going to be like the lower intensity, like kind of more boring stuff. And you have to find a way to do that and still be able to, I think, like function in the rest of your life. Where like the stuff that we think of as more high intensity strength training and things like 2 times a week is probably going to be good for that. And like figuring out a way to like make it only 2 times a week and get the most out of that so that you can actually have more time in your week to do the stuff that is actually building your ability to recover becomes more and more important as you get older. But it certainly becomes like a mindset switch, I think, when you have to recover from something specific, like pregnancy, like a surgery in any way. And that's something I'm starting to really consider more as a physical therapist, that it's not about like the specifics of what's healing from the surgery. It's more about the capacity to heal, period. So, and that's coming from like you have to build a capacity that might be different than what you thought. And then that's something that I think will lead into like the rest of our conversation about like behavioral change. Because when you have to like switch gears in your mentality, like anytime somebody's recovering or coming in for therapy, they might not know it yet, but they have to change. There's a behavior that has to change in order for therapy to be effective. And how we get people to do that is really the job. But like it broadly, like the best thing to think about from a change standpoint is we're trying to recover and trying to heal is we want to build the capacity to heal, which ends up being a lot of times like more time doing that aerobic stuff because it just builds like mitochondria, it builds like the structure for recovery and healing more.
Mm-hmm. No, absolutely. It's interesting, like what popped into my head as you said that. And just very briefly, one of the reasons that I'm here with Chris today is because I'm a mental health therapist as well. And that's actually my primary business. And I work with a lot of people who are looking to change behaviors and habits and things like that in their lives. And one of the things that you just said is like, you have to make space for that recovery to happen so that you can change, so that you can, behaviorally change. That goes for your mental health and the mental performance side of change as well. If there's not enough space in your life, if you haven't created the environment, maybe internal or external, to give yourself the opportunity to be successful in behavioral change, it's not going to happen. So that it's just it's an interesting kind of parallel, like whether that be your body's physical symptoms, your body's physical systems, or kind of more that mental piece. It's very similar.
Absolutely. So give an example of like a client you might see and like what their goals would be when they come to see you.
Sure.
And especially from like a behavioral change standpoint, like a behavior that they might want to change and how you get them started with the process.
So I'm a cognitive behavioral therapist, as I've mentioned before on your podcast, and I work primarily with athletes and high-performing professionals that want to improve their mental health and their mental performance. And so, you know, I do have like the athlete folks, and the behavioral change is pretty obvious when it comes to them. So I'll speak a little bit more towards maybe like towards a high achieving professional who's also somebody interested in movement and things like that. So I'll have folks come in who their goal might be to that they're well, usually it's not their goal coming in, but they're coming to me because they're feeling maybe a little bit depressed or down, not able to maintain a schedule or a routine. And so they're just overall not feeling great in their mental and physical health. So they're burning the candle at both ends at work. They're socially not that engaged or engaged in the way they might want to be. And they're not going to the gym, which they wish they were doing. They're not eating well, which they wish they were doing. And then they come to me and we say, okay, we're not feeling good. What are the goals? And we try to then synthesize, for them, what's the physical goal? What's the emotional wellness goal? So someone might come to me and say, I'm working 60 hours a week. I probably should be only working 40 to 50, but I can't focus. And so I'm not going to the gym. So we might start with a goal around focusing more at work, more like executive functioning skill buildings, but then also around that, how do you put the wellness pieces in place? Go to the gym, engage with a personal trainer, maybe things like that. So that's usually kind of the process. They don't usually come to me with a specific goal. They come to me with a set of problems, and then we work together to figure out what the goal needs to be the solution to those problems.
There's very much a parallel to that I find in therapy, and I don't think I recognized it as much when I was a younger therapist because it wasn't presented to me that I was like supposed to be looking at it that way in school, but it's certainly become more and more evident that when somebody's coming in for their initial evaluation, they have a diagnosis of a specific injury, and especially like the more chronic the injury. And I'm actually using that term loosely because I don't believe it is an injury. It's just like they're having chronic pain, and there's nothing that they can point to. It's like I injured something here and something's healing because it's way beyond a healing process.
Yeah.
So now it's just sort of a sifting through complaints and history to actually then say, okay, like what's the actionable thing we could work on?
Yeah.
Right. And the nice thing about movement is I've learned this, that sometimes me saying very little and just getting people moving in and having a structure for that so that I feel like they're going to be safe doing it. But it leads to a better, more direct conversation eventually, instead of having a long history and a long subjective. And it, depending on like who you learn from, sometimes they're like, well, yeah, get everything in the conversation. You get everything in the subjective before you start moving. I feel like for some people that's helpful, but like when you're dealing with chronic issues, sometimes the best thing to do is just like let's try to dwindle this down and like actually create a goal, because like you don't have a goal right now. You're just in pain and you just want life to change, and I get that, but we don't have anything objective to actually work with until we start a process. And with movement, it's a lot easier to do that, I find, because you just, all right, let's see what you can do here. Tell me how that feels, and then we go from there.
No, and I think that actually crosses over really well to the work that I do around the mental performance of behavioral change, because we can take a history, and we do, and I do all the assessments and all the things, but the humans are just really bad historians.
Right.
Our memories are not that great when it comes to especially how we feel, whether
Right.
that be physical or mental, emotional. So for me to be sitting there and asking them, what are the thoughts going through your mind when you're having these issues or when you're feeling this way? They can tell me, but the real time thoughts, okay, this is what I want you to do. I want you to, as you're going and you hit this kind of trigger or bump in the road or obstacle when it comes to the change, I want you to sit there and take a moment, open up the notes page on your phone and write down what you're thinking and feeling. That is much more helpful data for
Yes.
us to work off of than the historical data that I'm collecting from you in an assessment. It's not, doesn't mean I'm not going to ask the question, but if also a listener is trying to make behavioral change on their own at home, one of the things that I would, really recommend you do is, you're trying to make this change in real time. Try to check in with yourself and ask yourself, what am I feeling and thinking right now? Because that's going to be far more important than trying to like analyze like this, kind of uh larger view of what's going on.
Right.
In the
Absolutely.
moment data is
100%.
far more helpful.
And it's absolutely the same thing with pain, where like the biggest question that I'll tend to get is what's wrong, right? So which is that kind of global, I want to find out like what's wrong with me structurally. And that's usually what someone's seeking out, because I feel like it's a way to seek actually simplicity. Because like if there is a something wrong, then I know that there is a something that can fix it, as opposed to like we're embarking on a process here. And there's really not, unfortunately, there's not an end game. There's just growth. But sometimes you'll come out way better on the other side, hopefully. But it's an ongoing process. And I think that the idea of pain, though, becomes this thing where it's like I need it to be fixed, as opposed to we actually have to use it. So like the real time idea is, for me, it's like going from the where to the with what. And if we're actually identifying the with what, then we have a much better conversation. And sometimes the with what is actually not during the session of movement. It is when I wake up in the morning. It's when I'm still, but just being able to delineate those things, like that surprises people. Like if somebody can't feel it during movement and they feel it like during rest, they think that I just feel it all the time. But like actually separating that out in their head, that it is a something. When you're still, it is a something physiologically to your body. Like you're now dealing with gravity. There's a pressure that's building up, and just being able to like make there be a connection and a relationship there. It's not this just random I heard all the time, but it becomes like there's something that we have a connection to. There's times where it's better, there's times where it's worse. That becomes like really the starting point.
Yeah, no, absolutely. And again, crosses over
Yeah.
like as a one-to-one when it comes to the mental side of that. It's, when is it harder? When is it
Right.
harder to continue to follow the plan, continue to move forward with the goals? When is it easier to do that? And let's break that down and talk about it. Yeah.
And kind of a similar question, but like, what do you find like if session one with a lot of people, that are you sending them home with homework? Or is it like the notes discussion that you're talking about, like document something when you feel it in the moment? What are
Yeah.
the most common exercises you might give someone?
Yeah, in the earlier phases of like a traditional therapy relationship, there's the assessment. So I'm not going to count that as session one because that's me asking a lot of
Right,
questions
right.
and just getting to know the person. But after that first session, in that first session, especially if the person, if the client and I have made real meaningful progress towards goal setting. Sometimes that takes a couple of sessions
Sure.
for us to work that out. But if we have, then I do spend some of that session trying to engage the client in what we call psychoeducation, which means I'm kind of teaching the client about my therapeutic lens that I'm viewing this through and kind of the model that I'm viewing it through. And that usually ends with a conversation around some level of starting to be self-observant, whether that be emotions, whether that be thoughts. Now, I have some people that come in and they are rationalizers. So their
Right.
thoughts are going a mile a minute. So the homework for them may be more feeling into the body. What am I feeling in this moment? Where am I feeling it in my body? Where do I hold my tension in my stress in my muscles and
Mm-hmm.
things like that? And trying to get them to notice that more, especially if they're really in those thoughts. For other folks, it would be checking in on thoughts. So that is definitely something that starts for me and in my modality of practice, kind of right from jump, because again. I am happy to, and does become important with folks for us to go back into history sometimes and work out maybe some traumatic events or difficult times. But when it comes to behavioral change, the here and now is far more important and will drive change far faster than trying to break down what's happened in the past.
Perfect. Do you find that you have certain archetypes that you see, and like what I mean by that, like I could say like with physical therapy, like there are people that are wider bodies and narrower bodies, and generally I'm looking and I'm saying like the narrow body is probably going to do better with these type of exercises. The wider body will do better, and it's broad, and it's supposed to be broad because it's like a starting point that does help lead treatment. Do you find you have that with either, like you mentioned, like rationalizers, like kind of a mental process for the way that people deal with things, and then that helps you know what practices would be better and some that wouldn't be so effective?
Definitely, because while I'm a cognitive behavioral therapist, kind of first, that I do have other modalities that I'm trained in. So, um, to go back to something we were talking about a few minutes ago, which is the rationalizer. The rationalizer is while can do great in cognitive behavioral therapy, if I don't first start with connecting them back with their bodies and with their emotions, then it can be a losing battle to go into those thoughts because they're already going a mile a minute. So with folks like that, I might be more inclined to start with more breath work, more grounding, more feeling based interventions. Where with somebody who is feeling a lot or maybe feeling not anything at all, maybe a little bit numb and not really engaged with their thinking, I may start off more with like, okay, what are the thoughts, and try to kind of bring those to the forefront. So absolutely, it definitely makes a big difference with kind of what the person is experiencing. And then if somebody has trauma, that's like a whole different situation, and we're kind of pausing to kind of bring the person definitely back into their body and things like that. So definitely they're the archetypes, but also issues or presenting problems. Like I have we've talked on other cast about this, about my history working in substance use disorders. So I do get a lot of people that come to me that are high achievers, but are also dealing with substance use. So that's going to take a little bit of a different avenue as well. So it just depends.
And you could speak to this if this sounds familiar, but like I as I started to get into like meditation years ago, and I tried to like integrate the idea of it into practice. One of the things I noticed was that, like for me, for some reason, like I took to the idea of sitting still and trying to meditate. Like I found that I had like faith in the process, if you will. Like even though if it didn't like work right away, it's just like I felt like it was leading to something, and then it was a practice that built.
Mhm.
But there are certain like personalities and archetypes that I have that just like we all need to get to a similar place where you need to calm down the nervous system, be able to get into maybe like a more of a parasympathetic place for recovery. But just like meditation just is not the avenue for some people, or the way that it's taught as like stillness. But presence and mindfulness always is there. It's just like different avenues for different archetypes. So like for others, like if just having somebody do more like zone 2 cardio becomes like that avenue to like feeling more calm, more present. And I feel like there's even some like archetypes there where it's like, what are you trying to get out of this practice? Well, meditation has like many purposes, right? Like sometimes you're not trying to calm yourself down at all. You're just trying to like get more insight. And that can be a very stimulating practice. But like if the goal is to try to get somebody to be more accepting, more present, more patient, right? I think those are all categories that lead you more to like that rest and digest state.
Mhm.
But it is like, I think interesting how you can manipulate movement. And for those that aren't comfortable with stillness, at least initially, movement is a gateway to more stillness. So, like, but it's got to be the right type of movement that oftentimes, again, is time consuming. But it's like if you're doing like 30 minutes on an elliptical, it's not that dissimilar to doing 30 minutes of sitting still. It's just one's going to be a lot easier for someone early on than the other. So I just find like that there's parallels to movement and meditation that I didn't quite grasp before. And sometimes like you need to give one to someone where others do well with more of the stillness work.
Yeah, absolutely. And I think that goes also for um on the mental health side of things. Like some with the breath work, we're often talking about like diaphragmatic breathing with
Mm-hmm.
chest, which has to do with like vagus nerve
Mm-hmm.
activation, which has to do with secreting hormones in the brain that feel good to us and calm us down and engage our parasympathetic nervous system. So that has like one, for me at least, as somebody that likes to be grounded in neuroscience when I can, has a very particular uh, function to do the breath work. But if we're just talking about kind of calming down and coming into the mind, there are so many different other options that we can talk about. Gratitude journaling. There's a lot of like positive psychotherapy techniques that can be used. So again, going back to what the person needs, and then also what they can tolerate, what they
Mm-hmm.
like. Some people, are really into the breath work. They can jump right in, and other folks, not so much. And
Yeah.
so I think depending on what the goal is, we can definitely kind of lean towards different tools and customize it to the
Yeah,
person.
absolutely. I think the another archetype that is somewhere in there is like the idea of kind of a quick change and what's happening physiologically in the body where you like feel like a quick neurological change, like you're able to change your pain right away versus something that takes a little like more endurance, but more time, more duration to give you the positive effect. And I think that's something where like if you've experienced like the idea of going for not a hard run, but a longer run, usually it doesn't feel good until like you've been running for a little while, or like any type of aerobic endeavor where it's boring at first, like your body might be stiff to it, but then you get into this point where you've been doing it longer and you're just like your mind's working better, your body does it kind of numbs out to the and it feels a little bit like euphoric, but in a very different way than like a really high intensity workout does, where I know you and I have been there, like afterwards, especially when you're doing it with other people, like you're so social, like and
Mhm.
your energy is higher, but
Yep.
like it's like short lived. Like there it's not necessarily going to be a crash later, but it's not like it's not something I want to go focus. I actually want to go do more things. Like I want to go like I'm full of energy, but I'm not gonna sit down and do like something that's focus work for an extended amount of time. And I think that's like easier to get in the short term because all you got to do is like bring your fitness up to increase your intensity. But it's a lot harder for people to actually do the boring thing that takes time to feel the value of. So, and I feel like there's a bit of that within meditation too, where it's like you're not going to 2 minutes might not give you much insight, but 40 minutes might, and part of that's going to be uncomfortable. And the insight that you gain from doing that over and over again is something that's just like it's hard. You have to have patience for it. And I think there's this gateway to some of that patience work can be we do more of the lower intensity, longer duration stuff, but even that is a path to build. So like 5 minutes might be an eternity for people, but eventually you're getting to the idea that 30 minutes is not unreasonable, 40 minutes is not unreasonable, and depending on how you do it, even longer still. And that goes back to I think our initial like conversations, like how do you build more time of movement or even like stillness and rest and recovery into a busy day when you're a parent, when you got a full job, because it's super important. But like it also just puts you in like a different experience in life if you can get into those practices more often.
Totally. And I think even more than just like whether it's 5 minutes or 40 minutes, whether it's meditation, whether it's movement, whether it's, any like mental practice that a therapist might give you, it's also about doing it over time,
Right.
and being repetitious with it, that short term versus long term. People will start therapy, for instance, and make a big change right away because there's this motivational kind of spurt. So, they'll get to the gym all the time and start eating differently, or, decrease their alcohol use if that's what they came to me for, or whatever, leave work on time for once, things like that. Those things happen very quickly and then they fizzle out. Well, then you don't get to see any of the benefit. You don't get that insight, that kind of like lasting behavioral change that becomes more a part of you than just something you do. And I think that's really hard for people, is to be sustainable, not only just to sit down and do the work, put the time in, but also to work that into their lives on a repetitive basis. Because for those folks that make those big spurts right at the beginning of therapy, we do see that there's going to be a regression. And then if the person can continue to integrate it, we see that progress over time. But I think when you get that big spurt or that adrenaline rush that you're kind of talking about, you're like, oh, I got it. The brain, something happens in your brain, and it's definitely a chemical process. I'm just not sure what it is in this moment, where you're like, check, don't need to do that again tomorrow. Well, actually, you do need to do it again tomorrow, So
the way that I see that manifest a lot of times is somebody will come in and they have a lot of excitement. And the more excitement they have that they've identified something that's useful for them, the less permanent I know it's going to be, or the less like ingrained in their behavior it is. But I do think it's an important start. Yeah. But for the individual that's coming in, they're so excited about it because they feel like they've identified something that they don't need to work on it anymore. It's like it's an epiphany. They've had an epiphany about something, but the excitement is sort of a tell that it's short-lived. But it is like maybe the first step to identifying that there's the possibility of a change.
Yep.
But when it becomes more ingrained, every time you feel the change, it's less of a big deal.
Yeah.
Because it's just something that you do, right? It's like, okay, I feel sore. I've recovered from that soreness. It's like, this is what I do to recover. Right. And it's interesting. Like, I think when you, the better somebody feels in a moment sometimes could be a tell that like, they're not quite there yet.
Yeah. And I think for me, what that always tells me I've got to root back down into is someone's values and purpose. The definition of the term grit, and I know the term grit gets thrown around a lot, but it is a psychological term coined by Angela Duckworth, and the definition of it in a very like scientific way is passion and purpose towards long-term goals. And so when somebody has that spurt, that's amazing. They get that rush, but like, okay, how does that feeling connect back to your passion for whatever the goal is? How does it uh tie back to the purpose behind it and how it's connected to your values and how you want to live your life? And that's a lot of part of behavioral change, is taking those big feelings, that dopamine rush, that I feel good about this thing that I've done, and saying, okay, that's great. I love that. Let's make sure we root that back down in the why. Because if you don't root it back down in the why, it's really the likelihood that it's going to extinguish is extremely high. And so that's something that people can also do on their own if they're trying to make changes on their own, is say, I feel really great about this. Okay, why? Why is this important?
Right.
Why is this a part of the journey that I want to keep happening? Because you're right, you're not going to get the same dopamine hit every time. By the 15th time, it doesn't feel as good. But if by the 15th time, it's very much rooted in a value system and a purpose system, you're much more likely to keep going.
Right. In Tibetan Buddhism, they talk about like the contrast between like passion and dispassion.
Mm.
And it's very much like, I don't want to use the word promoting because nothing is actually being promoted, but it's like viewing and observing the idea of dispassion as something that can be a good thing, like a good sign, because, or when you're practicing your meditation, that you do it from a dispassionate place. And I think it never made sense to me when I was first, learning about it, because we put so much value in the idea of having passion towards our goals. And it's not saying that that's not useful. It's saying that, like, I think what we're talking about here is that it's just a start,
Mhm.
and it sort of can take you out of the idea of process, because you sometimes you get so passionate about, like, there's an end game that, like, I'm just trying to get to the end of the road and then I can rest.
Mhm.
Where the dispassion allows you to take on the behaviors that you need to change, and the life that you're living, and be able to enjoy it with that presence. But you need a little bit of dispassion to be more present,
Mhm.
because the passion is usually leading to something in the future that you're excited that you're closer to.
Yeah.
Right. And I just, like, I think that it's a tough concept to coordinate, I think, or like to contemplate. But it was talked about quite a bit, especially within like Shambhala. And
Mhm.
I feel like that has a little bit of a parallel to this idea of, like, when something is more ingrained and you're just noticing it, you're not that passionate about it. But when it's like the first time you notice something, yeah, you'll be more passionate about it. So it's ultimately like more of a continuum than it is like a dichotomy. But like, I think there's some wisdom there.
Absolutely. And I think knowing that, whether it's physical pain or a physical goal or a mental performance goal or whatever you're focused on, you said something about the end of the road. Recognizing and coming to terms with the fact that there actually is no end of the road, there is no end game.
Right.
A life without pain is just, that's not a thing. Like pains come and go. A life without emotional distress, that's not a thing. Things come and go, things happen. You will always be needing to maintenance whatever changes you make in your life,
Mhm.
because humans, when we stop maintaining things, will always regress to the mean. It's just how we, and the simplest version. So it's just how we do it. And I think letting go of this idea on a mental, emotional level that there is an end of the road is extremely helpful to staying motivated over a long period of time. And that's why when I was a personal trainer, I really didn't put much stock in weight loss goals. That wasn't
Mhm.
really a part of the work that I did with folks, and I really don't like to talk too much about weight loss goals in that way in therapy, because that insinuates that there would be a day in which you would hit this number and then it would be just fine,
Mhm.
and it would be over, and your health and fitness would be like checked off your list. And that's just not reality. That's just not the way the world goes, or how human behavior goes. So I think letting go of that idea that an end of the road even exists is a helpful one. And I'm not saying don't set goals, but then, just to use an example from my own life, something I love is like, you hit that deadlift number. All right, now
Mhm.
you're just setting another one. So there
Right.
was an end to that road, but it's not done. I
Right.
just have to hit the next one.
Yep. This will be something I'd love to get your take on, is using monitoring devices or like apps for gaining just more insight, like more like basically being present, but being present through technology.
Mhm.
And who that works for, who that doesn't work for. Like for me, it like makes a ton of sense. Like I look at like monitoring one's heart rate, monitoring one's blood pressure. Like if I'm monitoring more things, it's sort of like a objective mindfulness,
Mhm.
right? As long as it's being viewed at in a non-judgmental way, just so I'm gaining information and then I can adjust based on that information. But something I've certainly observed is like that there's so much resistance from many people to do any of that. And it actually like creates anxiety when it's even brought up.
Yeah.
So in your experience with your clients, do you have to navigate those waters? Do you promote any of that? But do you find that there's people that it just doesn't work well for?
Yeah, that is like a highly individualized piece, I think. And I think it has two components to it. The first is if it's going to be used and it works for somebody, they really have to understand what the data means. Because I think
Right.
the problem with a lot of this technology is it's become really easily accessible and available, and that's great. However, people don't actually know what the data and the numbers that they're receiving mean within the context of their own health and well-being, and their own experience. So like a number for one person can mean something totally different than it does for another person within like the greater picture of their own health. So I think for one, if somebody is going to do that, they need to be working with some sort of provider that can explain that to them and put it in context for themselves, so they know what that data means. So that's one thing I will say, because people will misconstrue things all the time, and that leads to a lot of distress and a lot of anxiety, I think. Second is there are people who are just rule outs for me on those types of things, right? Like, I think it's less for me about who is this good for, and that becomes a trial and error thing, and more is like, who do I know this probably isn't great
Right.
for? And for me, that's people that tend to be a little bit more obsessive in their thinking, and in their behaviors, a lot of checking behaviors, things like that that get in the way of being able to focus on either the bigger picture or other things in their life. Those would be folks that I'd really not suggest that for, especially when it comes to anything like calorie counters and things like that. I'm pretty out on most of those things for the majority of my clients, because again, they're usually not that accurate, and they need to be viewed within a very broad context. So
Right.
things like calorie counters, I think heart rate and things like that can be very helpful for people when they monitor their anxiety, unless it becomes then an obsessive
Creates
piece
more,
where, I'm checking my heart rate because I have to make sure I'm safe. That's not a helpful thought. And I'd rather someone focus on their breath, their muscle tension, these other more uh, somatic or feeling pieces, as their subjective data rather than that objective data. So I'm not against it at all, and I think there are some people it works fabulously for. I think it's more a question of, do you know what these numbers mean and how to contextualize them, and two, who is it really not good for,
Yeah.
and how can you just check in with yourself and say, like I used to wear a monitor. I stopped wearing it actually because I got into kettlebells and I was afraid to break it. So I
Right.
stopped wearing it. And then I was like, ooh, I was really kind of dependent on that to like validate my effort.
Yeah.
And not wearing it for me as an individual, just as a person, was extremely freeing. But then I do know that for other people, it's just so helpful to have that data.
Yeah. And the thing I struggle with, or am just trying to balance, is like like you said, you want somebody to be supervising you in your understanding of the data, and that's part of our job, like, and I think that's like a increasingly more important part of what I do as a fitness professional and as a physical therapist. Like as this data and this information becomes more at your fingertips, showing people the value of it, but then also being able to navigate like, okay, if I'm not going to just keep going down this rabbit hole because it's not for this person, but what's the thing that I'd be gaining from it, and then I would see that the individual would gain from it if they were able to kind of accept it. I have to find another avenue to get them to be there, right? So like you mentioned, like calorie counters, and like regardless of accuracy or not, it's like mindfulness, right? Like you're just taking the time to document something. So if if there is like a consistency to that, then it's mindfulness of what you're eating in a way that if you were doing nothing wouldn't be there. But there's other avenues to get there. It's just like figuring out what all of those other options are to get you to the same end game of saying like you're just being more mindful of what you're eating.
Yes.
But like I do find that there are a lot of times where people are just like that is the limiting factor. They don't have enough information and they're justifying things and they're searching down other avenues, but they're just not doing like to me what seems like the obvious thing. But that's the behavioral change piece, which is always difficult, where it's like it could be it's most of the time it's obvious to someone else and it's not obvious to the person that's trying to change. But I do think like if you look at the nutrition science, like it comes down to you have to have an awareness of how much you're consuming, and it doesn't have to be obsessive, and it doesn't have to even be like perfectly accurate. It just has to be something that works for you and is consistent. So having a bigger bucket of categories, I think, gives you more options of how to do it. But that's one thing I'm just sort of like, for me, what the simplest thing would be to just have more objective data on more things that is easier to do. Like it's tracking without you having to necessarily take the time to do it. Like it's not as hard. You know, you don't have to like go to a facility and get it done. I think that is better for us as a culture because it gives us more information that we can adjust to. But at the same time, there's that reality that it could also be something that even makes you more obsessive if that's part of the thing you're working around.
Right. And I like what you said there about, and I'll just highlight it back to you, is like finding whatever the mindfulness or the tracker or the data points or whatever it is that works for you. And, whether that is, something you're wearing on your wrist or, a blood pressure cuff or whatever, being able to find what works for you and something that you're going to stick with. Because I think one of the things that you're bringing up that is super important is a lot of times the barrier to this data has been extremely high, especially historically. And I think that barrier is coming down and down and down. But what's the path of least resistance? Because a human will always pick that path.
Yeah, absolutely. And there's a natural ambivalence to change. And, that's the other piece where it's like, okay, if I'm giving somebody information that works for me, but it's like a big change for them, like I'm not likely going to get, oh yeah, like I'm excited about doing that right away. You know what I mean? So there has to be sort of like a little bit of a path to what eventually gets to maybe the most like kind of more of an excitement about, monitoring more things about yourself. But it is something that I'm like still dealing with and trying to figure out is like, I guess having more options for the same goal ultimately becomes the best thing. And that's where I think education comes in, where it's like, you do what works for you or what you've seen work for other people. But I think it's that it's seeking out stuff that like you don't even find useful yourself because it might be useful for somebody else. Like I think that's a big place of where I'm at in my career right now is I have a better understanding of what works for me, but like continuing education is about what doesn't work for me or like is a little bit outside of my wheelhouse and it's like I don't actually understand, but like it might be that thing that works for somebody else because they don't understand me, I don't understand them, you know what I mean? So just having more of those interventions.
And I think anytime you can present choice, because people love to feel like they selected it. That is like a very human thing we are much more motivated to do things that we feel that we have chosen to do. And so when I can offer someone maybe 3 options that kind of leads to the same thing, or we try something and they're like, this isn't really for me. I'm like, no worries. I got something else. Let's try this and see if this is for you. I think providing choice it can be a big benefit when we talk about people being consistent with whatever the mindfulness, whatever the tracking, whatever it is, allowing people to choose which one is best for them is huge.
Yeah, you could let me know what your experience is in the fitness space. Like one of the things I think is that like when we get into fitness, we're so much like exploring our own self, right? Like we get into training others because we like training ourselves and we found the value there. So we're always that like passionate person that's like learned something new about ourselves and wants to like go tell it on the mountain. But I think that becomes part of the issue, especially when you don't have the background education of psychology or like motivational interviewing or just like how to communicate with somebody. And even like in physical therapy, we spend a lot of time in school, but very little time on the psychology of like how to talk and question and try to change behavior. It's really much more about the physiology and the mechanics. But that's so huge. And when you start connecting the dots to, I like being active, I'm going to practice what I preach, but then you're preaching only the stuff that like you've experienced has worked for you, and you haven't tried other things because it's why try it if it's already worked for you. That becomes like a thing that I think comes with experience, and I'm glad I'm seeing more of like the psychology and the behavioral therapy get into fitness now, because we know like it's so necessary, so that it doesn't turn into this just do what I do because it worked for me, but it's like it's not people are different.
100%. And I think the more that we can focus on that, the more that we can tap into, again, like going back to this, the why, what's motivating you to be here? What do you really want to get out of this?
Yeah.
And focusing on that. And again, you mentioned motivational interviewing, so key. The more that we can focus on that, the more success we'll see clients achieve, whether that be a physical therapist, a personal trainer, a mental health therapist, anybody.
Well, I think this was a great conversation. Glad to hear a little bit more about the specifics of how you work with clients. I thought it was very useful for me. Hopefully it was useful for the audience. Great to see you again. And congratulations on being a mom, but being a mom again, and
Thank you so much.
It's all very exciting.
It is. And thank you for having me and engaging me in this conversation. It's always great to talk to you and pass ideas back and forth, and hope you have a great rest of your day.
You too.